hand sanitizer, a great substitute when soap and water are not available. It was the first day of school. I was taking my kids to school, and I had just purchased for each classroom a huge bottle of hand sanitizer. First teacher said thank you, but to my surprise, my daughter's teacher said, "Well, it's not quite time for the season of hand sanitizer, but we'll hold on to this." And I thought to myself, isn't every day the season for hand sanitizer? Shouldn't we be using this every day to prevent and kill germs? Now, I am a mom with a child with cystic fibrosis, which is a lung disease, so colds, flus, or any bacterial viral infections that go around the schools affect his lungs. So maybe I'm a little bit more paranoid than most moms on keeping my children's hands clean. But I like to be extra careful. Clean hands is the best way to keep him from getting any of these bacterial or viral infections. Now, according to the New York Times, there was an interview done by Deborah Franklin, and it states this. Dr. Lundstrom said last week in a phone interview, "We have so many people caring for ill family members at home. Maybe you're without running water from a hurricane or a blackout, or you've got a bad hip and you can't move easily to the sink to get your hands washed as often as possible. What about after you sneeze in a car or stop to put in contact lenses? In all those cases," she said, "alcohol-based hand sanitizers of the correct formulation could be a godsend, not to replace soap and water, but as an important supplement." End quote. I will be the first to admit that I am a crazy paranoid mom when it comes to keeping my children's hands clean. The second they come in the door, I tell them to go wash their hands with warm soap and water. In fact, I don't even have to tell them anymore. Now, how many of you were like me, like to keep your kids' hands clean, or kind of maybe a sort of a germaphobe? When soap and water are not available all the time, hand sanitizer is a great alternative for hands that are not soiled with food, dirt, or goop. Today, I will be covering 3 main points about hand sanitizer in schools. First, how hand sanitizer is beneficial in preventing germs, and washing hands quickly and effectively without soap and water, and reasons why using and purchasing the right hand sanitizer is necessary for killing the germs. Now that I've kind of told you that I'm a germaphobe of a mom and I worry about my kids keeping their hands clean, let's move on to discuss the 3 main points. The best way to keep hands clean is with warm water and soap for at least 20 seconds. But an alternative for non-soiled hands is an effective hand sanitizer. The prevention of germs helps keep our kids healthier. According to an article, Science in Our World, Certainty and Controversy, written October 2012, is hand sanitizer good for you? It says this: hand sanitizer is good for many obvious reasons. First, it does kill bacteria which could make you sick and cause illnesses. Therefore, in ways the hand sanitizer is preventing the spread of bacteria and illnesses. Second, it is very convenient and reasonably priced. According to studies done by Purell, the use of Purell reduces the amount of sick days. By putting hand sanitizers in schools and workplaces, it was found to prevent the spread of illnesses causing fewer sick days. Now, however, something is important to remember. Hand sanitizer is not to be placed and not useful in the bathrooms. Warm water and soap cannot be replaced in the bathrooms. I cannot stress this enough. On the WebMD website, it states this: both warm water washing and sanitizers are important, say Blatt and Brian Sassoni, spokesman for the American Cleaning Institute. Soap and water are number 1, says Sassoni. Hand sanitizers are a very effective tool. The sanitizers are meant to be a supplement, not to replace good old-fashioned soap and water washing. Sassoni says the CDC agrees. It says for non-virus, washing hands is your best prevention, especially after using the bathroom, changing a diaper, and before eating or preparing any food. Sanitizers may help, but they are not a substitute for washing with soap and water. Now, I hope we all can agree that washing your hands with soap and water is the best way to prevent germs. But also, that hand sanitizer is a great second supplement or alternative for preventing germs. Now, we can wash our hands quickly and effectively without soap and water by using hand sanitizer. The ideal situation would be that if our kids wash their hands after recess or a cough or a sneeze. But there's not always time for this. On the CleanLink website, Lori Huffman, who is the head of marketing of Stoco, answers if it's important to use hand sanitizers in schools. She says yes. When soap and water are not available, alcohol-based sanitizers are the next best thing to stop the spread of germs and keep students, faculty, and staff healthy, especially during cold and flu season. As most know, schools are like a breeding ground for germs and their transmission. It is unavoidable with the number of people in close proximity to each other all day, sharing keyboards and exchanging materials. It is nearly impossible to be near soap and water all the time, and sanitizers are perfect for this very reason. Now, there have been other studies done to answer this question as well. Is hand sanitizer beneficial in preventing germs in schools? In fact, a study was done, and an article from an online site called CleanLink has this to say about the study they did. We have in fact seen a significant results achieved with alcohol-based hand sanitizers in school settings. In one study conducted in schools published by the American Journal of Infection Control, absenteeism caused by illnesses was 50.6% lower in classrooms that used alcohol-based sanitizer regularly and implemented a hand hygiene education program versus classrooms that did not. Now, what are the reasons why using and purchasing the right sanitizer is necessary for killing germs? Well, let's talk about how to correctly use hand sanitizer. According to the Best Health magazine, an article says this about the correct way to use hand sanitizer. To use hand sanitizer effectively, make sure your hands are free of visible grime and dirt before applying the product. Then apply a palmful of product and rub vigorously for 20 to 30 seconds, making sure to distribute the sanitizer between your fingers, under your nails, and under your jewelry, on your wrists and the backs of your hands, of each hand. When your hands are dry, you're good to go. Never rinse your hands with water or wipe them with a towel after using hand sanitizer. This will counteract the effect of the product. Now, what is the correct type of hand sanitizer to purchase? Well, according to Ronald Lewis, an associate brand manager of Hinkle Consumer Goods Incorporated, he states, all forms of hand sanitizer, if they can contain between 60 and 95% alcohol, are potentially effective. Gels are easy to use and typically are the least expensive option. Foams have an advantage in clinging better to hands, reducing dripping on the floor or clothing. As you can easily see, the need for alcohol-based sanitizer is safe and effective when soap and water are not always able to be used. Now I've told you why sanitizer is a great way to protect your kids from everyday germs, and the importance of having hand sanitizer in the schools, and how safe it is. Using and purchasing the right hand sanitizer is necessary for killing germs as well. Now, what if your child was coming home weekly or monthly with some bacterial or viral infection from school that could have been prevented if there was the use of more hand sanitizer in schools and it was readily available? Now, if every parent or guardian donated a couple of dollars or a few bottles of hand sanitizers a year, there'd be enough money or enough sanitizer to have it readily available for our children. And as we've learned, this is important. Even if, just think if 10 parents are protected, 25% of the kids were much healthier. Think about if we could get 80% of parents and guardians to donate a few bottles or a few dollars to go towards this, 80% of our kids would be healthier or more. The benefits outweigh anything. There'd be less doctor visits, less medication, and my kid's favorite, more time to play with friends. My hope is that we'll all go out and purchase a couple bottles of hand sanitizer to donate to our children's classrooms to help preventing the cause of spreading of germs. Also, by donating and taking hand sanitizer is the first step in showing our teachers how concerned we are about their health, our children's health, and how we want to help take care of this problem. And we want to help in the schools. Thank you.